Okay. For this question, it's going to be focusing on study type. So you can look at that question at the end. The study is best described as which of the following. Um, these questions can pop up on step one. And again, I think that they can be some freebies if you understand the basics of study types. So I think it's important to know those, randomized control trial, things like that. So let's dive into this question stem. Over 1 year, so we know it's not just like a point in time, studies conducted to assess the anti-leukemic activity of new tyrosine kinase inhibitor in patients with chronic myeloid leukemia and blast crisis. All patients enrolled in the study are informed that they would be treated with tyrosine kinase inhibitors. So the patients are informed. They know that they're getting this treatment. They are assigned to successive dose cohorts of 300 to 100 milligrams per day or 1,000 milligrams per day of the drug. 6 to 8 patients are assigned to each dose. Treatment efficacy is determined based on the results of the complete blood counts and bone marrow assessments conducted regularly throughout the study. So I think it's important in these question stems to not get caught up in the information about how they're determining treatment efficacy and things like that. And like even the tyrosine kinase inhibitor. I mean, we could literally read this as over 1 year, a study is conducted to assess the efficacy of a new drug in patients with a disease. I mean, you can dumb it down to as much as that so that you don't get caught up in those details. So here we're looking at treatment efficacy. The patients are, okay, so let's go ahead and go down to the answer choices. So a case control study, I mean, it says it in the name. There are patients that are in a case group and a control group. We can already see that in this question stem, there is not a control group. Each of the groups are all get the treatment, just in different successive dosages. So we can go ahead and already cross out case control study because there is no control in this study. Crossover study, we'll skip that one for now. And then we get into open label clinical trial, randomized clinical trial, and single blind randomized controlled trial. So all of those are very similar. And I can go ahead and say that on this study, I mean, it sounds like a clinical trial, right? We want to see what dose is the best for this treatment efficacy for this drug to treat chronic myeloid leukemia. So getting into open label, randomized, single blind randomized. So is anyone blinded in this study? And what that means is, in this case, it would mean the patients would not know what dose they were receiving or if they're receiving a placebo or a drug. But in this case, they do know. They're assigned to a dose. And the researchers also know 6 to 8 patients are assigned to each dose so that they can determine which dosage helps the treatment efficacy best based on the complete blood counts and bone marrow assessments. So they have to know which patients are taking which dose to be able to see how the treatment is working. So it's really not blind. So we can go ahead and mark off E. And next we're getting into open labeled or randomized. Is this randomized? Did they put this into a random generator saying that Susie gets 300 milligrams and Johnny gets 1,000 milligrams? No, they're just assigned to successive doses. So there's really nothing randomized about it. So we can go ahead and mark off D. And we know this is a clinical trial. We're looking at the treatment efficacy of this new drug. And it's open label. Everyone knows what they're getting, the researchers and the patients, and we're able to look to see which of those patients' complete blood counts and bone marrow assessments look the best based on that. So we can go ahead and circle C, open labeled clinical trial, as the answer choice to this study. Again, I think that it's important to know the basics, the breakdown definitions of what these words mean, because it can really help you rule out a lot of answer choices and get you some freebies on step one.